Bonjour tout le monde.
Good morning, everyone.
Be joined today by Minister Anand and Minister Carr, as well as Dr. Tam and Dr. Njoo. Chaque année,
Every year, when we get to the May long weekend, we know that there is about a month left before the official start of summer. After a difficult winter and spring, we are all very eager for summer. This year, the long weekend was even more special because it marked an important turning point in our struggle against COVID-19. Over half of Canadians have now been vaccinated.
have now received at least one dose of a COVID-19 vaccine. And that number is going to keep going up fast because millions more doses are coming. We now rank number 3 in the G20 on doses administered per capita. It's clear that working together as one big team Canada is paying off. To all of our healthcare staffs at hospitals, pharmacies, and vaccination centers, thank you for being part of this historic effort. You're doing a great job. Keep it up. We're all so deeply grateful. And to everyone who's now eligible to book a first dose, we're all counting on you. Make sure you get your shot when you can. If we all do our part, if we get vaccinated and continue following public health guidelines, we will have a much better summer and we will get through this crisis once and for all. There are lots of reasons to be hopeful, but that doesn't mean we can let our guard down yet. In a number of places, we're still facing a very serious third wave. Last Friday, I reached out to Premier Pallister about the extremely concerning situation in Manitoba. I also had a call with Mayor Brian Bowman of Winnipeg. I let them both know that the federal government is ready to do whatever it takes to keep Manitobans and all Canadians safe. As soon as a province asks for more assistance, we're there to help. That's why, in anticipation of Manitoba's official request for additional support to manage the situation, we're preparing to deploy federal health human resources. We're also looking at deploying medical staff through the Canadian Red Cross and sending support from the Canadian Armed Forces. In just a few moments, Minister Carr will speak more about additional support from Manitoba and what we're already doing in the province. Since the beginning of this crisis, our government has worked closely with all provinces and territories to make sure everyone is safe. And as long as this pandemic lasts, that's exactly what we're going to continue to do. Ce jeudi, on va
This Thursday, we will be holding another meeting of all provincial and territorial premiers. We will first talk about the measures that we need to take to end this third wave, and right now that has to be our #1 priority. We will also talk about the various reopening plans. The premiers around the table will have the opportunity to share their experience about what is working well across the country. And on that note, as we are gradually reopening, we have to not let our guard down. The number of new cases has to be brought as low as possible. We are all very pleased to see a loosening of restrictions where it is safe to do so, but we have to remain responsible. Everyone has to do their part. You need to continue to follow local health restrictions and get your vaccination as soon as you can. If we do all this, together we will have a better summer. We will be able to see our friends on the patios, and we will be able to eventually get through this crisis. Today, I also want to take a moment to mark the first anniversary of the death of George Floyd in Minneapolis, United States. We all remember the horrible images of that murder that scandalized and changed the world.
And it was a reminder that there are still too many people living with anti-Black racism and injustice, including here in Canada. Last summer, Canadians, and especially young people, marched to demand change. From economic empowerment through the Black Entrepreneurship Program to proposing to remove ineffective mandatory minimums from the criminal code, to historic investments in community organizations, our government is working with Black communities across the country to make sure nobody is left behind. We will continue to take real action to fight systemic racism and create more opportunities for Black Canadians and for everyone. Before I end, I'd like to say a few words about the arrest of the Belarusian journalist, Roman Protasevich, over the weekend. The behavior of the Belarus regime is outrageous, illegal, and completely unacceptable. This was a clear attack on democracy and on the freedom of the press. We condemn it and call for his immediate release. We also condemn this kind of dangerous interference in civil aviation. Canada has existing sanctions in place against Belarus and will be examining further options. We also strongly support action through all available international institutions, including the International Civil Aviation Organization, the Organization for Security and Cooperation in Europe, and NATO. We stand in solidarity with our partners in defending journalists all around the globe. Merci. Je passe maintenant.
Thank you. I will now give the floor to Minister Carr. Jim?
Jim, you might be on mute.
I want to begin by acknowledging that I'm joining you from the traditional Treaty 1 territory of the Anishinaabe people and the homeland of the Métis Nation. The COVID-19 situation here in Manitoba is serious. We are experiencing surges, more variants of concern, and climbing ICU rates. Our healthcare system is reaching its limit. To our essential workers, I want to say thank you. To the exhausted nurses, doctors, and other hospital staff who've been on the front lines of this latest surge, you have the gratitude and respect of our entire province. Teachers, custodians, grocery store workers, public transit operators, you've kept life going for us. You keep stepping up. Thank you. Across our province, we are feeling frustrated. Sometimes we even feel angry. We're exhausted by this virus. We've endured a first, second, and now third wave of lockdowns, of business closures, active case counts, and most tragically, lives lost. If you've lost your job or are anxious that you might lose it, if you've had to close down your business, this new surge in the virus may feel crushing. And in light of the current situation, today, departments and agencies across the federal government have again come together to support the government of Manitoba and the people of our province. In response to the recent request from the government of Manitoba, the government of Canada is preparing to deploy additional federal health resources, including medical staff through the Canadian Red Cross and the Canadian Armed Forces. The Armed Forces will support vaccine rollout in 23 Indigenous communities in Manitoba. And we are also providing 50 additional interviewers to do contact tracing across the province. The Government of Canada is also prepared to deploy epidemiologists, lab technicians, and increase testing capacity from the Public Health Agency of Canada and Health Canada to respond to needs identified by Manitobans. Since the beginning of the pandemic, we have responded to all 17 requests for federal assistance for Manitoba. The National Emergency Strategic Stockpile has allocated over 37 million units of personal protective equipment, vaccine ancillary supplies, and other medical equipment to Manitoba, including nitrile gloves, disposable gowns, face shields, N95 respirators, and surgical masks. Manitoba has requested additional biomedical equipment, which the NESS expects to be able to supply. I would like to thank municipal leaders, such as Winnipeg Mayor Brian Bowman, for their leadership, and to Premier Pallister for his cooperation. We all share a common goal, keeping Manitobans safe and building back better and strong as quickly as possible. For the Manitobans who are watching this update, stay home if you can, get vaccinated, and encourage the people you care about to do the same. There is hope. More Manitobans are getting vaccinated every day. Canada is in the top 3 countries of the G20 delivering daily vaccinations. It's up to us to stay vigilant, follow public health guidelines to drive case numbers down. Get vaccinated. As the Prime Minister has said, the federal government will do what it takes for as long as it takes to keep Manitobans and all Canadians safe. Thank you. Dr. Tam, over to you.
Thank you, and bonjour à toutes et à tous.
Good morning.
Additionally, prior to the long weekend, we were seeing strong and steady declines in disease trends, and data after the long weekend will tell us whether these trends continue. The latest 7-day average of 5,000 or fewer new cases reported daily is 40% lower than the peak of activity in mid-April. The number of people experiencing severe and critical illness is also decreasing as overall infection rates come down. The latest 7-day average for the number of people with COVID-19 being treated in our hospitals each day has dropped by 20% since peak activity to about 3,400 daily. Of these, on average, of about 1,300 were being treated in intensive care units, which has dropped 10% since the peak, and average daily deaths are down 15% to 41 deaths being reported daily. With 4.5 million COVID-19 vaccine doses delivered before the long weekend, and Canadians continuing to roll up their sleeves as vaccination clinics expand across the country, our fastest moving trend is happily that of vaccination coverage. Last Friday, we reached the milestone of 20 million people having received at least one dose of COVID-19 vaccine to date. This number is increasing fast. To continue to make the progress we need, each of us has a key role to play on the vaccine runway. By getting vaccinated as soon as we're able and keeping up with essential precautions, such as masking and spacing, we can sustain our strong and steady progress while more vaccines roll out to help us bring this curve in for a landing. Regardless of your vaccination status, following the advice of your local public health authority, choosing lower risk activities and settings, and keeping up with essential precautions will help protect the progress we've made and set us up for a better summer while we get our house in order for a safer fall. We've been asked to do a lot to protect each other, and it would be great if we could say that this was the last wave we've ever need to worry about. But until the infection rate is well and truly down, we can't regain the upper hand and get our public health, laboratory, and health capacity back on top and ready for the fall. If we can continue cautiously through the summer, while immunity is building across the country, we'll be able to reestablish proactive capacity for laboratory testing, genomic sequencing, case investigation, and contact tracing to interrupt the spread at source. Working together, we can end this pandemic and get back to the connections and activities that enrich our social and economic life and well-being in Canada. Thank you.
Bonjour à toutes et à tous.
Good morning, everyone. Across the country, before the long weekend, we all saw an important decline in case numbers and the trends. And we will see after the long weekend whether these trends continue. 5,000 cases are being reported every day, and this is much lower than what we saw in mid-April by about 40%. And we also find that hospitalizations are going down as vaccinations are going up. And so we find that every day we have seen a decline, which now amounts to 20% since compared with mid-April. We have about 3,400 people in our ICUs, which is a 10% decrease compared with April. And we have now 41 people on average dying every day, which is 15% lower. know that Canadians are continuing to roll up their sleeves as vaccination clinics expand across the country. Our fastest moving trend is happily that of vaccination coverage. And last Friday, we reached the milestone of 20 million people having received at least one dose of COVID-19 vaccine to date. This number is increasing fast. To continue to make the progress we need, each of us has a key role to play on the vaccine's runway. By getting vaccinated as soon as we are able and keeping up with essential precautions such as masking and spacing, we can sustain our strong and steady progress while more vaccines roll out will help us bring this curve in for a landing. Regardless of your vaccination status, following the advice of your local public health authority, choosing lower risk activities and settings, and keeping up with essential precautions will help protect the progress we've made and set us up for a better summer while we get our house in order for a safer fall. We've been asked to do a lot to protect each other, and it would be great if we could say that this was the last wave we ever need to worry about. But until the infection rate is well and truly down, we can't regain the upper hand and get our public health, laboratory, and health capacity back on top and ready for the fall. If we can continue cautiously through the summer while immunity is building across the country, we'll be able to reestablish proactive capacity for laboratory testing, genomic sequencing, case investigation, and contact tracing to interrupt the spread at source. Working together, we can end this pandemic and get back to the connections and activities that enrich our social and economic life and our well-being in Canada. Thank you.
Thank you, Dr. Njoo. The Prime Minister will be taking 3 questions on the phone, 1 question, 1 follow-up. Same for reporters in the room. Ministers and Doctor will remain available for 15 minutes afterward to answer more questions. Merci, Dr. Njoo. Le Premier ministre va prendre 3 questions au téléphone, 1 question, 1 sous-question. Même chose pour les journalistes dans la salle. Les ministres et docteurs demeureront disponibles pour 15 minutes par la suite pour répondre à plus de questions. Opératrice, c'est à vous.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. La première question, Catherine Lévesque, La Presse canadienne. Your line is open. À vous la parole.
Oui, bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. I would like to come back to what you said last week about the Constitution and the fact that Quebec wants to change it, because that created a lot of concern and fear, especially in English Canada. So I would like to ask you to clarify your remarks. Do you agree that Quebec is a nation and French is its official language? Answer. For a long time, the federal government has recognized that we have 2 official languages, but that Quebec has a special role to play in protecting French in Quebec, and we continue with that view. However, we do also intend to ensure protection of official language minority groups across the country, including Anglophones in Quebec. We will defend those minorities' rights. With respect to Quebec being a nation, I have stated for a long time that Quebec does form a nation. It is a province that I have long recognized that French is its official language. Catherine, question. I want to come back to what was confirmed last week, and I want to know whether your government is going to intervene to protect that Canadian citizen. If we receive an extradition request from France, we will certainly respond as we should.
Request from Quebec, that'll be, if we receive an extradition request from France, we will, of course, analyze it with the full rigor that Canadians expect us to.
Thank you. Operator, next question on the phone.
Thank you. Merci. La prochaine question, the next question, Dylan Robertson, Winnipeg Free Press. Your line is open. À vous la parole.
Good morning, Prime Minister. What do you think the need for federal support in Manitoba's ICU says about the provincial government's planning, preparedness, and response for the third wave of the pandemic, given what we saw in the weeks in other provinces from the impact of this wave?
Thanks, Dylan. Obviously, we are deeply concerned about the situation facing Manitoba, which is why I reached out to the Premier and the Mayor of Winnipeg on Friday to talk about what more we could do. As I said, we stand by to send more support, whether it's through the Red Cross, whether it's through the Canadian Armed Forces, whether it's frontline workers. My job as a federal leader is to be there to support Canadians in every corner of the country, not to judge how provinces have managed it. It's simply to be there to put the interests of Canadians first, and that's what we will always do. Jim, do you want to follow up on that?
Yes, Prime Minister. We're squarely focused on the needs of Manitobans, and when the request comes from the provincial government, we have been there to respond and to respond quickly, whether it's adding vaccination capacity within First Nations, adding more epidemiologists, more public health officials through the Red Cross and the Canadian Armed Forces. We respond to the changing needs within the province as expressed by the Premier and by public health professionals. We have been here for the people of Manitoba, and that's the focus of our attention, and that's why we are making these further announcements today.
Following up, Dylan.
Prime Minister, the Manitoba Premier says North Dakota wants to share vaccines with the province, but it's being blocked by the Biden administration. Do you share that understanding, and is our ambassador to Washington advocating to make this happen?
We have been, since the beginning of this pandemic, working with partners around the world, including the United States, to ensure that we get through this as quickly as possible. The conversations continue, including at the level of our ambassador in Washington. We will continue to try and make sure that we're getting Canadians vaccinated as quickly as possible so we can get through this and get life back to normal, and as well turn even more efforts to helping the world get through this, because we don't end this pandemic anywhere until we end it everywhere. Nous avons, depuis les débuts de cette pandémie, travaillé avec...
Since the beginning of the pandemic, we have worked with our partners around the world, including the United States, on the need to get Canadians vaccinated as quickly as possible, and we continue to work with our partners in the United States, in particular through our wonderful ambassador to Washington, and we are making every effort to get everyone vaccinated as quickly as possible so that we can get back to a normal life, and so that we can help people around the world, because we know that the pandemic will not be over anywhere until it is over everyone.
Thank you. Merci. La prochaine question, our next question, Hélène Buzetti, Les Groupes de l'Information. Your line is open. À vous la parole.
Oui, bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. I want to come back to this issue of the Constitution, because last week your remarks were criticized by many in the country, especially outside Quebec, and in the Globe and Mail, there was mention of that. It seems like this clause about Quebec being a nation can be interpreted differently and applied to other aspects of the Constitution. At least that's the fear, and I would like to know what you think about that fear. I don't share that interpretation. Answer. Hélène, question. Okay. Perhaps you could give a little bit more detail. You don't think that there is any risk. Some people also are concerned about the Anglophone minority in Quebec and feeling that you are abandoning them and that French as the official language of Quebec could be interpreted as meaning that Quebec Anglophones' rights won't be respected. Answer. As I have said, we will always be there to defend minority rights in Canada, including those of Anglophones in Quebec. We know, though, that Quebec needs to take steps to protect French, and we are working with others, including the provinces, to protect language rights.
Glenn McGregor, CTV News. Prime Minister, you've said repeatedly you don't want to have an election campaign during the pandemic. Will you commit now to not going to see the Governor General, whether interim Governor General or permanent appointment, unless the House of Commons has voted a lack of confidence in you until the point that the World Health Organization declares the pandemic over?
As I've said, it has been one of the strengths of this country that political parties, that across different orders of government and indeed within Parliament and assemblies have been able to work together to get unprecedented support out to Canadians. I made a promise from the very beginning that we would have Canadians' backs no matter what it took for as long as it took to get through this pandemic, and that has worked. And by and large, other parties have supported that. We have seen, however, that we need to continue to have a well-functioning parliament so that we can continue to get support out to Canadians, and that is very much my focus. Nobody wants an election before the end of this pandemic, and we certainly hope to be able to continue to deliver all the helps that we promised to Canadians without over interference by opposition parties. Depuis les débuts de cette pandémie,
Since the beginning of this pandemic, we have promised that we would do everything necessary to support Canadians regardless of how long the pandemic lasted. We have been fortunate in Canada that all of the political parties across the countries and here in the federal parliament have been able to work together to put in place support measures. But the pandemic is not over. We still need to deliver assistance to help Canadians get through the pandemic. And I hope that the opposition parties will provide their constructive support for that. But we will work on that, and we know that nobody wants an election before the end of the pandemic, because the pandemic is our priority.
Mr. Trudeau, with the Canadian Press. What assurances or documents do you have that Moderna is actually going to be delivering on their contract, considering that they're supposed to be the workhorse of our vaccine campaign this summer? Has Moderna been clear about what's causing the delays?
Actually, I would argue that Pfizer has actually been the reliable workhorse of our vaccinations. They have continued to deliver, although Moderna, particularly in the early months, being able to deliver so many doses to the Arctic and to remote Indigenous communities, made a huge difference in preventing further outbreaks up in the north. We are very fortunate as a country to have had so many different deals with so many different companies to allow for the position we are in right now, where more than half of Canadians have had at least one dose of a vaccine. That is what is going to get us through this. But on further comments on vaccination schedules, I will turn to Minister Anand.
Thank you so much, Prime Minister, and thank you for the question. Let's be clear that, as the Prime Minister said, the benefit of our diversified portfolio is that it allows Canada to pull in millions and millions of doses from multiple suppliers. We have 25 million doses distributed in Canada to date, 21 million doses administered. In terms of your specific question relating to Moderna, the supplier has communicated to us that millions of doses are expected to be delivered in June, and that the first shipment will come in the first part of June. I spoke with Moderna this morning, actually, and my team has been on the phone with them over the past weeks, including over the past weekend. The point that I have repeatedly stressed to Moderna is the urgent need for a delivery schedule relating to June and July deliveries. But rest assured, we will be receiving millions of doses from Moderna during the month of June. We are waiting a delivery schedule from Moderna itself. Canada remains very much on track to receive vaccines for eligible Canadians to receive a first shot by the end of June, and for all Canadians to be fully vaccinated by the end of September. Thank you.
CBC, just a follow-on to that. There were some questions last week because there was a 48 million dose number put out there, then it was more than 40 million. What's the latest on that? What do we know about how many doses we're getting when?
The latest is that we have now vaccinated over half of eligible adults in Canada, and everyone who can now schedule an appointment should be scheduling an appointment. We need to get everyone vaccinated. We remain absolutely confident that we will have more than enough doses in Canada by the end of June to give a first dose to every Canadian who wants one. And second doses will continue to ramp up through June and into the summer. The exact numbers on Moderna, as the minister has said, we are waiting for a scheduled delivery. But again, I can assure all Canadians there will be more than enough doses by the end of June for every Canadian who wants it to have gotten their first dose, and already starting on moving forward on second doses. Anything further to add, Anita?
Sure. I will just add that figure of 40 million provided by the Public Health Agency of Canada represents only confirmed deliveries. That is, only confirmed delivery schedules are provided to the provinces and territories, and that information hasn't changed. What that number doesn't take into account is the 1 million doses from AstraZeneca that we are expecting in late June, and the millions and millions of doses that we are expecting from Moderna in June as well. And so, as the Prime Minister said, we are very much on track to have vaccines for all eligible Canadians to receive their first shot by the end of June, for all Canadians to be fully vaccinated by the end of September. And as soon as the delivery schedule comes in from Moderna, I will be sure to share it with the Public Health Agency of Canada and, of course, the provinces and territories. Thank you.
Tonda McCharles, Toronto Star. Prime Minister, I'd like to hear you elaborate a little bit on some of your earlier answers around the Quebec amendment. And you kind of were very abrupt with Hélène when she asked you about how do you interpret this idea of Quebec as a nation. And I'm interested in your remarks in French. You did say Quebec forms a nation, but what the House of Commons has recognized is actually Quebecers form a nation within a united Canada. So since you seem to be suggesting it's only about language, so if you could just elaborate a little bit more on your thoughts about, to you, what does this phrase mean, the phrase that Quebec is seeking to put in the Constitution?
My responsibility as a Prime Minister is to defend the Constitution and to ensure that all Canadians have their rights upheld. That means protecting both French and English throughout the country, and that means ensuring protection for official language minorities across the country. That is something that I have never wavered from and will never waver from. At the same time, we've all been through the constitutional battles of the past number of decades that have left many scars on many people. I choose always to look forward, look to how we can continue to protect French across the country and in Quebec, while at the same time ensuring protection for linguistic minorities, including the Anglophone minority in Quebec. These are the things that matter most to me and will continue to matter tremendously to all Canadians. At the same time, there have been recognitions that Quebec forms a nation. It is a historical fact, a sociological fact, a fact of daily lives. and it is something that even Parliament has recognized. We need to move forward and ensure at the same time as we are protecting French within Quebec, we are also protecting linguistic minorities in Quebec and across the country. Ça a toujours été une priorité pour moi.
It has always been a priority for me to defend the Constitution, to defend French and English across the country, and to recognize, as we have recently on a number of occasions, the need to protect French, including in Quebec. We have brought forward recommendations for updating the Official Languages Act, but at the same time, we want to protect Anglophones in Quebec and Francophone minority communities across Canada. I have recognized, and Parliament has recognized, that Quebec forms a nation, but it is important for people to have protection for their language across the country. That's what I believe in. Good morning. I want to talk about our disputes over milk, over softwood lumber with the United States. Nothing seems to be moving forward. Do you feel that in the end, Joe Biden's attitude may not be very different from that of Donald Trump? So have you spoken to him about that, and what are your views? Answer. Certainly, President Biden has reaffirmed the U.S. commitment to multilateralism and to free trade. Of course, there are going to be discussions about trade, and that will continue. But we worked with President Trump, and we will work with this administration. We protect Canadians' rights, and we have continually defended supply management and our farmers and our economy. Of course, there will always be some differences of opinion, some disputes, but we will always be there to defend Canadians.
With the arrival of the Biden administration, there has been a significant change in the United States' engagement towards international rules-based order, towards multilateralism, and towards particularly the fight against climate change and the economic opportunities that go with it, which have all been welcome. At the same time, there will always be issues upon which Canada and the U.S. Have disagreements. We will always defend supply management and our dairy producers, amongst others. We will always stand up for our forestry workers and the industry across the country. We will continue, as we did successfully in the previous administration, stand up to defend Canadian interests and values wherever necessary, and that will continue.
Last question, Global.
Minister Michael Couture with Global National. B'nai B'rith Canada is reporting that the number of anti-Semitic assaults recorded so far in May of 2021 surpasses the total of all of the year 2020. So I wanted to get your reaction to that sharp rise.
There has been a really troubling rise in anti-Semitism, not just recently, although yes, recently, but over the past years as well. And the rise of intolerance in Canada, whether it's anti-Semitism or Islamophobia or anti-Asian racism or anti-Black racism, needs to stop. We need to be there to pull together, to understand that people can have disagreements, but intolerance and hatred has no place in Canada. As a government, we have taken significant strides on investments, on support for community programs. in terms of anti-Semitism, we appointed Erwin Kotler to be our international representative on Holocaust remembrance and anti-Semitism. We've adopted the Holocaust remembrance definition of anti-Semitism. We have demonstrated strong leadership on that, both at home and internationally. We will continue to, as we continue to move forward, to push back hard against intolerance and hatred of any type, anywhere in Canada. There is no place for that in our country.
Merci beaucoup, Monsieur le Premier ministre. C'est tout le temps que vous avez.